Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. Now for the most urgent. This week's most urgent headline is the national lawsuit over protected SNAP data. SNAP, or Supplemental Nutrition Assistance Program, is a federally funded program providing food assistance for families at or below the poverty line. Last week, a Wisconsin judge joined 20 other states suing the USDA for demanding SNAP data, including beneficiaries' names, addresses, Social Security numbers, immigration status, and much more. The purpose of this data collection is for what they described a national database, separate from the official SNAP database, and the complaining states claim that no jurisdictional and justifiable clause for such a demand should be in place. Many states are concerned that their SNAP funding will be delayed by refusing to deliver the data, and the lawsuit specifically accuses the USDA of fueling a catastrophe for families in need across this country. Now on to the damage report. Last week, President Trump released an executive order that directs Health and Human Services to require forced admissions of unhoused individuals in hospitals and in behavioral health centers across the country. Currently, hospitals serving high-volume populations often can't accept patient admissions from the emergency room in a timely manner. This causes some patients, especially those needing behavioral health services, to stay in the emergency department for days at a time. This is a very common problem made even worse by COVID-19 pandemic and subsequent staffing and funding shortages that our hospitals face. In addition, between 2011 and 2021, the rate of homeless people entering emergency rooms has more than doubled. And based on reports from hospitals across the country, emergency rooms are often serving as a source of shelter and food rather than strictly for medical intervention. Under the new executive order, hospitals will be required, that's right, required to board unhoused individuals struggling with a mental health condition or a substance abuse disorder. The president's claim that this will improve homelessness and keep the public safer from unhoused individuals needing crisis intervention. However, keeping such an individual in a hospital doesn't resolve their housing status or keep the community any safer. Instead, the order is expected to further extend hospitalizations of psychiatric and unhoused patients, tax hospital operations past their capacity, make it even more difficult to care for patients with true medical needs. Patients with mental health conditions and substance use disorder pose an increased risk to healthcare workers, making this executive order dangerous not only to patients, but to our staff as well. Behavioral health is a vital part of providing care, but this kind of legislation and executive order puts the burden of that care on emergency departments, which should be equipped to respond to the most emergent medical needs. ERs are already breaking down under the weight of drained resources, and enforcing this order will do even more damage, especially since psychiatric care is primarily funded by Medicaid and will suffer great losses from the One Big Beautiful Bill. The issue brings us face to face with what many have described as a devastating future for both rural and urban hospitals and communities alike.
This is Kirsten Newland, producer of Rural Health Today, and I'm excited to provide today's success story. Our Rural Health Today host, JJ Hotshire, has been recognized as an American Hospital Association grassroots champion for his effective advocacy efforts. The Michigan Health and Hospital Association honored Hillsdale Hospital's president and CEO with this award at their recent annual meeting, calling JJ a tireless advocate and citing his work defending the 340B program, which makes critical pharmaceuticals accessible for hospitals and communities, and his work to protect Medicaid, including expert testimony and countless media stories, according to the presenter. The work JJ has done here on the podcast has played an important role in the advocacy efforts recognized by this award, and we're grateful to every listener and guest supporting Rural Health Today.
Thank you to our sources for this episode: Wisconsin Public Radio, the Center on Budget and Policy Priorities, Becker's Hospital Review, and the Michigan Health and Hospital Association.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.